Now, another shakeup at HCMC. The interim CEO, Dr. J. Kevin Croston, announced he is resigning immediately. It comes as HCMC faces a dire financial situation, a $200 million shortfall with a possibility of closing in June. Raya Katene joins us with more on what all this means going forward. Raya?
Well, Julie, Hennepin County Commissioners appointed Dr. J. Kevin Croston and David Huff back in January to lead HCMC together. But with one of those leaders now stepping down, the hospital's challenges only continue to pile up. Less than 3 months ago, J. Kevin Croston took the job of leading the Hennepin County Medical Center and took on the task of tackling its mountains of debt. He was helping address HCMC's dire financial crisis, but on Wednesday, Croston stepped down from his role as co-administrator, citing in his resignation letter concerns of micromanagement and the overruling of certain decisions. So what happens now?
That is entirely at the discretion of the county board. They can decide what kind of leadership structure they want to have.
How soon that decision will be made isn't clear. Matt Anderson, who is a senior lecturer at the University of Minnesota School of Public Health, says that's also up to the county board.
There's no legal timeline. They can make the decision anytime.
Anderson says HCMC provides a safety net of care for a wide range of patients, including those who are uninsured or reliant on Medicaid, and offers a wide range of specialty services.
Also for its teaching role, virtually every physician who is trained in the state has been trained through HCMC's ER.
The hospital's projecting up to $50 million in operating losses this year alone. It's been pleading for help from the state, but if a solution isn't reached, its leaders say HCMC could be forced to close its doors as soon as June.
There are things that it could do before that scenario or short of that scenario of saying these are services we're no longer going to provide, but we're going to continue to operate the emergency department. We're going to continue to operate inpatient care units.
But if it gets to that worst case scenario, Anderson says the ripple effects of HCMC's closure could impact healthcare as we know it in Minnesota.
It is hard to convey how significant this is.
Now, we also heard from Commissioner Jeffrey Lundy today, who serves as the Hennepin Healthcare Board Chair. And he says in part, Dr. Croston stepped into this temporary leadership role at a critical moment, helping guide an initial response to the organization's urgent financial challenges. His leadership helped position Hennepin Healthcare for the work ahead and reinforced our commitment to preserving access to essential care. Julie.
All right. Thank you, Raya.